Quite a number of those people are in the room today. I don't know whether they want to identify themselves or whether you'll just be able to see them from their mugshot that's coming up there. We have been meeting, a group of us, service users and colleagues from substance misuse and mental health, looking at how we can support service users into volunteering. At the moment we have met for 2 very full development days, with one more planned where hopefully we'll bring a lot of the work that we've been doing together and get that up and running starting in August this year. To where we are. For a long time it has been appreciated within our substance misuse and mental health services just the positive aspect of activity for people with these issues and how that can be rewarding and beneficial, going back to our notion of well-being for people, that connecting and that positive activity can be very, very rewarding and beneficial for people. And I suppose a lot of that has then been brought into sharper focus with the increasing recognition of recovery and recovery journeys and how these can be built on that recovery capital that people can bank for themselves through that notion of social, physical, human and cultural areas of their lives. I suppose again a lot of the research that's around at the moment clearly shows that the greater involvement individuals have with positive, meaningful activity, the greater their chances of sustained recovery. And this also being further enhanced if through these they have the opportunity to engage and have contact with recovery champions who provide positive and inspiring role models for them. A lot of these things, I suppose, prompted several of our group to reflect on how Crossreach as an organisation can improve the experience for the people that we're currently working with, that would also benefit the people that we hopefully will work with in the future, and also reap some of those rewards for ourselves as services of having people who've gone through that system be really involved in what we're doing. So it all started, for those of you who know Glenn, this will be no surprise, it all started with a meeting in a coffee shop. And that has led on, as I say, to the process that we have gone through to date. So the outcome from these meetings has been to look at what would be required to fully support service users into that volunteering role and how to sustain them in that role. A lot of our thoughts have been informed by other people's experience. We've looked at reports like Experts by Experience that came from the Scottish Recovery Network, and recruitment and retention of volunteers from Volunteer Development Scotland. Focused our attention, I suppose, on various different aspects. We wanted to be clear about the volunteering opportunities that we would have available for people, and for this to be not tokenistic either in the way that we've approached it, developed it, or hopefully will implement it. Being clear about the criteria that we were setting so that we would get best fit with the volunteers and with those opportunities, again with the notion that that would improve that sustainability and get people to actually really appreciate and benefit from what they were engaging with. The 3 services that we currently have involved in our pilot at the moment are away looking at those volunteering opportunities at the moment, but these are some of the opportunities that might be available for people in the different services that we have. And we're hoping initially to recruit 12 volunteers into our pilot initially, and then, as I say, hopefully grow from there. We're looking at the support that volunteers would need. We're looking at the mentoring that people might need within the service that they volunteer in, supervision within that service, and also perhaps supervision that they might require external to that service that they're volunteering in. We were looking at some of the training requirements, then looking at perhaps how Crossreach continue that development for people who are volunteering with us. And being a fairly large organisation, we have lots of policies and procedures that have guided and implemented and challenged us at times in how we do that. The mentoring, what we're hoping to do is put in place something that's very similar to what we have in place for our new employees, where volunteers would have a named mentor who would be there as a guide, someone to ask questions of, someone to help them through the training that we would be putting in place to begin with. And we'd hope that these mentors would have a clear understanding of what that mentoring role is and would have benefited from some training themselves to be able to support people into that role. Supervision, it's crucial for us all, supervision. So again, we're hoping that the supervision we will be offering our volunteers, again, would be very similar to what we have for staff. Looking at kind of a minimum of 4 supervisions every year for people, but that also being dependent on the volunteers' needs and the role that they're undertaking. So a lot of those things would be ironed out with the volunteer and the service they're volunteering in and be agreed in a volunteer agreement. The other aspect of that is the recognition of the specific needs that service users may have, and therefore the importance perhaps of having peer supervision or supervision from somebody who has a greater understanding of the issues around substance misuse or mental health. And again, I suppose we were thinking longer term when perhaps we're looking at having our volunteers working in service or in other cross-street services, either in services to older people or services to learning disabilities, where they maybe won't have that appreciation of the additional issues. We want to make sure that that wasn't going to be a stumbling block or a place where the volunteering would fall down. Training. There's a list of some of the training that we are hoping to put in place for people. A lot of it is generic training, but we would also be looking at service-specific training once we know what roles people are taking up, where they're going to be placed, what responsibilities they will be taking up. And that's going to be delivered currently over a 12-week period with taught input and also self-directed training and being guided by their mentor within their service to do that. The ongoing development aspect of it, we'd hope that we would be able to value our volunteers and allow them the opportunities to access the other training that we have within Crossreach. So again, just some of the idea of the other things that they may be able to access, and that hopefully would also include the train the trainer, so they could start taking on some of the responsibilities of doing the training. So as this grows, hopefully, we'll be able to recruit the volunteers into doing that as well as actually volunteering in services. And hopefully, eventually, we'll be able to offer SVQ either units or a full SVQ to people. And again, hopefully increasing their employability, their sense of well-being and getting something very concrete out of their volunteering experience. The policies and procedures. Large, well-established organisation, we do have quite a lot of policies and procedures, but we did also already have a volunteering policy, which has helped us and guided us quite significantly through this process. It hasn't been without its challenges. We've had to have fairly in-depth discussions around things like relapse prevention, risk assessment, the notion that people need to be 2 years into their recovery before we can be thinking about volunteering and things like that. So we've had to overcome those things, and I think we've done that quite successfully, so that we're able to support people fairly seamlessly from service user into volunteering opportunities. So I've lost my place now. The other aspect of the policies that came up quite strongly was, for some people it was going to be very important to think about relapse prevention and whether that should or shouldn't include random, regular drug or alcohol screening. I think the conclusion we came to was based on trying to make this as open as possible, and people can be on anywhere on a spectrum on their recovery journey, that would be something again that the individual volunteer and the service that they're volunteering in would make decisions about. And if it was something that, particularly the volunteer, because it was a lot of the service users and volunteers that were very vocal in feeling this was very important for them, that would be something that they would be putting in place within their volunteer agreement with the services. That we didn't want to put any more barriers in place for people who may not at that point be abstinent, that it is open to lots of people, and that would impact on risk assessments, and we can't avoid that within our organisation, and certainly maybe some of the roles that people would be looking to take up. So we've all been away beavering about dealing with these issues, bringing things together. We have a final meeting hopefully on the 24th of July when we will all come together with finished articles, and hopefully from that date we'll be looking at when we can actually implement this. And we're looking, or I'm looking, at round about the 15th of August for us to start rolling this out. That would allow us by the end of the year to have gone through the process, be able to evaluate how it's gone, get feedback from all those that have been involved, and then hopefully be in a position at the beginning of next year to think about rolling this out again for ourselves. There are still some ongoing questions. We are going to review this. What criteria are we setting? Whether we will do it again. When do we start broadening it out with cross-reach? All of these things that we're still, I suppose, struggling with a wee bit. And hopefully, once we've done it once, we'll know some of those answers. So roll on the 24th and we'll get it all up and running. Thank you very much.